government interventions, access to quality healthcare services in Borno State remains a major challenge, as seen in the recent outbreak of acute watery diarrhea in Mafa, Konduga, and Jere local government areas. The disease was first reported in Shauri North within the Maiduguri Metropolitan Council and has claimed one life. Government and non-governmental organizations are intensifying efforts through awareness campaigns and community-based interventions aimed at containing the spread of the disease and providing treatment for affected persons. The Borno State Ministry of Health is also responding swiftly by distributing drugs and medical supplies to frontline health facilities while carrying out sensitization campaigns for members of the public. Now, let us examine the links between poor sanitation, displacement, and unsafe water sources, as well as the efforts being made by Borno State government to curb the outbreak. Good day and welcome to Panorama on NT Maiduguri Zonal Center. I am Abubakar Musa. Thank you for joining us. President Bola Ahmed Tinubu has promised more transformative programs and projects for the development of Nigeria. The president, who was speaking at the Africa CEO Forum, emphasized that Nigeria must sing the right tune to show right direction to other African nations. To attain the much desired development, President Tinubu said it is important for every good citizen to pay tax for development and protection of the future. Lagos State is accelerating reforms in its transport sector with a renewed drive to modernize traffic management and strengthen road safety through digital systems. At the 2026 ministerial media briefing marking Governor Babajide Sanwo-Olu's 7th year in office, Commissioner for Transportation Oluwaseun Oshiemi announced plans to introduce a state-aligned driver's license in collaboration with the federal government. Joy Ken Abakoya reports. I'm meant to understand that Joy's report is not ready, so let's move on. President Bola Ahmed Tinubu has approved the appointment of Adedayo Benjamin Lani as the Director General and Chief Executive Officer of the Mariam Babangida National Center for Women Development and members of the Governing Council for an initial term of 4 years. In a letter signed by the Secretary to the State Government of the Federation, Senator George Akume, issued by the Permanent Secretary, General Services Office, Dr. Ibrahim Abubakar Kana, MNI, the appointment, which takes effect from April 18, 2026, is in accordance with the provisions of Section 7(1) and 3 of the National Center for Women Development Amendment Act 2023. President Tinubu also approved the constitution of the members of the Governing Council of the Center as follows: Princess Joan Jumai Idonije, Chairman, Governing Council. Other members are Louis Auta, Jamila Serki, Aisha Beyi, Jumoke Okoya Thomas, and Princess Anne Agom Eze. While congratulating the Director General and members of the Governing Council on their appointments, President Bola Ahmed Tinubu extended his best wishes to them. Let's talk politics now. In a renewed push ahead of the 2027 general elections, the Mieti Allah Polaku Yeso Development Association has endorsed President Bola Ahmed Tinubu for a second term in office. The association made its position known during an interactive session with the Minister of Livestock Development in Abuja, where it commended the Tinubu administration for what it described as far-reaching reforms in governance, policy direction, economic management, and societal transformation. Yusuf Jika completes the report.
As momentum builds ahead of the 2027 general elections, the Mietia Lapulaku Yeso Yeso Development Association has aligned itself with the renewed Hope administration, saying the government's policies have given pastoralists a stronger sense of inclusion and improved their socio-economic well-being. President of the association, Abubakar Suleiman, commended President Tinubu for creating the Federal Ministry of Livestock Development, describing it as a bold step toward transforming the livestock industry and addressing the long-standing challenges of farmer-herder clashes.
Our members nationwide has gotten their PVCs to support your re-election for the second time coming to 27.
Minister of Livestock Development, Idi Mukhtar Meha, says the ministry is driving reforms aimed at moving the livestock sector from traditional practices to a modern, resilient, sustainable, and globally competitive industry.
Pastoralists from over the country have seen beyond the emotions to make themselves available to align themselves with the President's vision for national ranching policy. So we've had this engagement with them, and we have asked for a database of their membership.
You're also poised to promote peace, which is one of the key pillars in our plan as a ministry.
He noted that the reforms are part of deliberate efforts by the president to strengthen the capacity of livestock farmers, boost productivity, enhance food security, and contribute to Nigeria's broader economic transformation agenda. In Abuja, Yusuf Jika.
Arising from its National Executive Council meeting, the National Union of Teachers has appealed to the federal government to rescind its decision to waive UTME for students seeking admission into colleges of education. Addressing the media after the NEC meeting, President of the Union, Titus Audu Amba, believes that members were not carried along when the decision was taken. According to him, the action could be counterproductive as it could discourage applicants and make the teaching profession an all-comers affair. He said as bedrock for development, applying to study in colleges of education should be maintained and made highly competitive.
This singular act is not acceptable to us because as critical stakeholders, we were not consulted for us to be able to maybe share ideas and possibly see reason why government may decided to come up with such thinking. If in the first place the teaching profession is being made attractive, I don't want to believe that government will even begin to think of having waivers. Why didn't they have waivers for other courses? If you are going for any science courses, give waiver. I will say no to this very policy.
Amba said improving the welfare and condition of service of teachers and the profession, like in the developed societies, is the only way that can make the profession lucrative and attractive in Nigeria. Let's look at issues that have to do with politics again. Governor Babagana Umar Zulum has appealed to aspirants contesting for various elective positions under the platform of the All Progressives Congress and other party stakeholders to embrace consensus as the best option for the emergence of candidates ahead of the party primaries. The governor made the appeal during a critical stakeholders meeting held at the multipurpose hall of the Government House, Maiduguri. Here is Mohammed Goni with the rest of the story.
The meeting, which drew major stakeholders of the APC across Borno State, followed the release of the timetable for the party's primaries. Governor Zulum commended party leaders and members for their continued support, loyalty, and commitment towards strengthening the APC and supporting the program of his administration.
Let us work towards peace, unity, and progress of our party.
He stressed that adopting consensus candidate will further promote unity, stability, and mutual understanding within the party. The governor reassured stakeholders of his commitment to fairness and democratic principles, emphasizing that no candidate will be imposed on any constituency. He urged aspirants to remain patient, loyal and committed to the party, noting that those who may not secure ticket in the 2027 elections could still have opportunities to serve in the future. Governor Zulum further disclosed that aspirants who willingly step down from contests will be considered for appointment and other responsibilities at both national and state levels. As part of efforts to ensure wider consultations across the state, the governor announced the constitution of zonal consultative committees. During the meeting, Governor Zulum also formally presented Mustapha Gubio as the APC consensus governorship candidate to stakeholders in fulfillment of the pledge he made at the high-level stakeholders meeting held in April. APC Deputy National Chairman North Ali Bukar Dalori and the State Chairman of the APC Bello Ayuba all re-echoed the need for consensus as the means of primary elections in the state. In Maiduguri, Mohamed Gwani, NTA News.
This is Panorama on the Nigerian Television Authority. We have more reports for you as soon as we return. We're glad to have you back. Now, 10 to 20 patients out of more than 100 persons suffering from acute watery diarrhea are being discharged daily across local government areas of Maiduguri Metropolitan Council, Mafa, Jere and Konduga. Permanent Secretary, Ministry of Health and Human Services, Dr. Shatima Maina Muhammad, gave the confirmation while giving an update on the situation of the disease. Unlike what used to obtain, the number of patients suffering from acute watery diarrhea within Maiduguri Metropolitan Council, Jere and Konduga have continued to drop significantly. This development may not be unconnected with the unrelenting commitment being shown by the Ministry of Health and Human Services alongside a team of medical experts and development partners as they have continued to review the situation adequately, especially in terms of treatment and response.
We activated all the pillars and protocols of emergency preparedness.
As a support mechanism, the Ministry of Health engaged 20 volunteers, while development partners on their part co-opted 30 persons, thereby making management of the acute watery diarrhea cases easier and faster.
The ministry dedicated some health facilities for treatment of those that are affected because it is a contagious disease. That is why you cannot just take them to any health facility.
Community health workers are currently carrying out door-to-door search in areas where there are suspected cases to identify affected persons for evacuation and treatment.
We are ready. His Excellency, Executive Governor of Borno State, graciously approved resources for us to procure sufficient amount of drugs and consumables, particularly intravenous fluids, antibiotics, and other drugs, and then, protective equipment and so on. And these were promptly delivered to these health facilities.
Patients have also been advised to desist from referring to the disease as cholera, but rather acute watery diarrhea, following verification in the laboratory. In Maiduguri, the question now is, what is the prevalence of acute watery diarrhea and how effective have government interventions been in containing the spread of the disease, and what more needs to be done to prevent future outbreaks? To provide further insight into these issues, we are now being joined by Dr. Shatima Maina Muhammad, Permanent Secretary, Borno State Ministry of Health and Human Services. Okay, sir, it's good to have you on Panorama today.
Thank you for having me, Abuja.
All right. Now, sir, what do you think are the major causes of acute watery diarrhea in Borno State?
First of all, acute watery diarrheal disease is a disease condition which is sudden in onset and is characterized by the affected person's stool more in frequency, volume, and fluidity. The consistency of the stools is very watery, and sometimes it could be mucoid or blood stain, depending on the causative agents, which are microbes. The most feared one among them and the most lethal one is Vibrio cholerae. There is Shigella, dysentery, Salmonella, and even the common malarial parasite. The consequences of this is that the person suddenly becomes very weak because of loss of fluid and electrolytes, and it may be accompanied by fever, abdominal pain, and other symptoms. So it is a common occurrence in the public health space, and definitely the causes and the predisposing factors are poor household and community hygiene. When people take contaminated water, when they take, there is poor sanitary hygiene, and more commonly is also associated with often defecation, where these microbes are then spread from contact to contact. So in a nutshell, it is caused by poor household and community hygiene. Of course, yes, we recorded cases in parts of Maiduguri metropolis, and these cases were investigated and promptly dealt with.
That is to say that people must imbibe personal hygiene practices.
Yes, personal hygiene and community hygiene.
All right. It's so great to hear. Now, what are the key measures taken by government to contain this outbreak?
Okay, the Borno State government, under the transformational leadership of His Excellency the Executive Governor of Borno State, Professor Babagana Umar Zulum, has made huge investments in the provision of health infrastructure and human resources. For the last 3 consecutive years, 2024, 2025, and 2026, they allocated over 15% of the budget of the state to the health sector. And that is why all the health infrastructures, new health infrastructures are being provided, and the existing ones are upgraded. And so these health infrastructures, health facilities in the state are ready, to address and contain this development. Under the Ministry of Health and Human Services, we have an institutional framework called the Public Health Emergency Operations Center. It is a well-equipped office working 24/7, headed by a public health physician, and the disease surveillance officers in the ministry and under the agencies of the ministry are in the community. They usually report these cases. For instance, in the recent outbreak of this acute water-real disease in parts of the metro, this disease surveillance reported it to the PHEOC, which is like a command and control center for addressing such issues. Stakeholders in the healthcare system were convened, they deliberated, and promptly a comprehensive and coordinated response plan was rolled out. And these include dedicating some health facilities, namely the Brigadier Abakari Memorial Hospital for treatment of these patients. Again, in collaboration with Medicine Sans Frontières, MSF, an infectious disease camp consisting of over 800 beds was established within the first 48 hours. And what we have in the state emergency medical services ambulance system established by the administration of His Excellency the Executive Governor of Borno State, Professor Babagana. These ambulances were quickly and promptly deployed to all the affected communities. They conveyed the affected persons to these dedicated facilities. Again, we also, provided drugs and consumables and, personal protective equipment and material for health workers. Resources were provided by the state government. The Jimtilo infectious disease hospital was quickly activated too, although those other facilities have already contained the cases. In emergency preparedness, we have to prepare for the worst case scenario, and it was activated waiting for a possible spillover from these facilities. And of course, the prompt response of treating those patients, conveying them to the health facilities, achieved the desired results. The surge in the first few days declined, and these incidents of acute watery diarrheal disease was contained. And as a preventive measure, again, health workers were deployed to all the communities to educate the people on to improving their personal hygiene and community hygiene. They should take clean water, so on and so they should be washing their hands.
We're actually about coming to that, sir.
Okay.
All right. Another fundamental question here is the issue of sensitizing, the public on prevention and treatment. So, what is the Ministry of Health and Human Services doing in that regard?
Yes, that is why I have said, according to the plan that was rolled out, it was two-pronged. One is treatment of the active cases, case finding, taking those that are affected and treating them. Let me also mention that, courtesy of His Excellency the Executive, all the drugs and consumables were provided free of charge. No any medical charges whatsoever was charged on any person. So people, health workers were deployed to the communities to, educate the people on good hygiene practices. They also identified points of contamination, and a multi-sectoral approach was taken because we have to even bring in rural water supply agency. They provided, chlorine for domestic, purification of water and disinfection of domestic water, and then disinfectants and fumigation of all the communities also was done. So, in a nutshell, the tempo of this education, educating the citizenry, good hygiene, community hygiene, and also to avoid open defecation will be sustained, so that these occurrences will be prevented.
All right, sir. How is the government, collaborating with development partners to prevent future outbreaks of this disease?
I think one of the strategies in the health sector is effectively partner and collaborate with development partners. Development partners are active stakeholders in our healthcare ecosystem. And therefore they contributed greatly in containing this outbreak of acute watery diarrheal diseases. They contribute, in capacity building of health workers and other, technical aspects of disease control. So we are working hand in with those developed partners. I mentioned that Medicines Sans Frontier, assisted in establishing an infectious disease camp.
All right, let me at this point say a very big thank you to you for being part of Panorama today.
Thank you very much, Abu.
And have a nice weekend, sir.
Thank you.
We've actually been discussing with the Permanent Secretary, Borno State Ministry of Health and Human Services, Dr. Shatima Maina Muhammad. Up next is sports.
Team Nigeria continues a medal chase at the ongoing Africa Senior Athletics Championship in Accra, Ghana, in an attempt to emerge the overall champions. As at news time, Nigeria is among the top teams on the medals table with some gold, silver and bronze medals, including the 4x400 meters mixed relay gold won by Team Nigeria. Similarly, Nigerian weightlifters consolidated their dominance at the ongoing 2026 Senior Africa Weightlifting Championship in Egypt after winning 9 additional medals to 10 medals already in the team's bag to cement their leadership position on the medals table with a total of 24 medals comprising 14 gold and 10 silver. In basketball, in his quest to recruit the best players for the national team, the Tigers coach David Visdal has contacted 14 NBA players of Nigerian heritage. Meanwhile, former D Tigers player Ekpe Udo has been appointed as one of the coach's backroom staff. In another development, the draws for this year's President Federation Cup Men and Women hold Friday at the NFF Secretariat, Abuja. A total of 32 teams will be drawn for the national competition in the women's category, while there will be a total of 64 teams in the men's competition. Cup holders Kwara United, Shooting Stars of Ibadan, Nasarawa United are among the contenders in the men's category. In the English Premier League, Arsenal remains on top of the league with 79 points. Second place Manchester City have 77 points. Going into this weekend encounters, Manchester United third with 65 points, with 3 tackles with Nottingham Forest with 38 points, while Aston Villa and Liverpool with 59 points each will lock ons to remain among the top 5 among other matches. With Sports Update, Olumide Eguntola, NT News.
And that is how it has been on Panorama today from NT Maiduguri Network Center. From myself, Abubakar Musa, and the whole team is goodbye and see you next time.